Hey there, welcome to HealthHack. In today's video, we're diving into a crucial topic: common medications that could increase the risk of dementia and cognitive decline. We'll explore which drugs to watch out for and how to protect your brain health. If you care about your well-being, stay tuned and don't forget to subscribe to our channel and hit the notification bell so you never miss out on vital health information. 8 medications that scientific studies have linked to an increased risk of dementia. No, memory loss is not an inevitable consequence of aging. Recent research shows that we can keep our brains healthy much longer than previously thought, as long as we know how to care for them properly. So why can seemingly harmless medications cause such severe damage? And how can we protect our brains while treating other health conditions? These are crucial questions that we'll answer throughout this video. It's important to emphasize that we're not here to demonize modern medicine. Many of these medications are essential for treating serious conditions and improving the quality of life for millions of people. However, it's critical to be aware of the potential risks and know how to minimize them. Let's start with 2 medications that seem harmless but can have devastating effects in the long run: omeprazole and anticholinergic drugs. First, let's talk about omeprazole. This medication is one of the most popular for treating heartburn, reflux, and gastric ulcers. It belongs to a class of drugs called proton pump inhibitors, PPIs. It seems harmless, right? Well, not so much. Recent studies have revealed a concerning connection between prolonged use of omeprazole and an increased risk of dementia. A study involving about 6,000 people showed that 10% of participants who took omeprazole for more than 3 years experienced memory loss. Another study found that 33% of patients who used the medication for more than 4.5 years reported cognitive disturbances. But how does omeprazole affect the brain? It's believed that omeprazole may interfere with the absorption of vitamin B12, which is crucial for neurological health. Additionally, omeprazole can alter gut microbiota, which in turn may negatively impact brain function. It's important to note that we're not suggesting you stop taking omeprazole immediately. If you use it regularly, talk to your doctor about alternatives or the possibility of reducing the dose. In many cases, dietary and lifestyle changes can help control gastric problems without the need for continuous medication. At HealthHack, our goal is to keep you informed so you can make the best decisions for your health. Now let's talk about anticholinergics. This is a broad class of drugs used to treat various conditions, ranging from allergies to depression and urinary incontinence. The issue with these drugs is that they block the action of acetylcholine, a neurotransmitter crucial for memory and learning. Studies have shown that prolonged use of anticholinergics is linked to a significant increase in the risk of dementia. For instance, a study by the University of Washington, which followed more than 3,500 elderly people over 10 years, found that those who regularly used anticholinergics had a 54% higher risk of developing dementia. Some common examples of anticholinergic drugs include first-generation antihistamines like diphenhydramine, certain antidepressants like amitriptyline, and medications for urinary incontinence like oxybutynin. The widespread use of these drugs, especially among the elderly, is concerning due to their potential to contribute to cognitive decline. If you are taking any anticholinergic medication, do not stop abruptly. It's essential to discuss with your doctor about safer alternatives or the possibility of reducing the dose. Patients and doctors must carefully weigh the risks and benefits of anticholinergic drugs, seeking alternatives when possible and limiting use to the minimum necessary doses and durations. Remember, the key concern here is prolonged use. Taking an antihistamine occasionally to relieve allergy symptoms is unlikely to cause long-term problems, but continuous use, especially in high doses, is what truly worries researchers. Next, let's discuss the hidden dangers of corticosteroids and benzodiazepines. These 2 types of medications, while effective in treating various conditions, can have serious side effects on the brain. Starting with corticosteroids, these drugs are widely used to treat a range of conditions, from asthma and allergies to autoimmune and inflammatory diseases. They are extremely effective at reducing inflammation and suppressing exaggerated immune responses. However, prolonged use of corticosteroids, especially when taken orally, is associated with several serious adverse effects, including the deterioration of mental and cognitive health. Studies have shown that corticosteroids can cause structural changes in the brain, leading to issues such as disorientation, confusion, depression, and anxiety. An epidemiological study in the United Kingdom, which analyzed data from more than 500,000 people, revealed that those who used corticosteroids for long periods to treat asthma had a significantly higher risk of developing dementia and other mental health disorders. Glucocorticoids such as prednisone and dexamethasone are particularly concerning when used long-term. These drugs can interfere with brain function, possibly due to changes in cortisol levels, a stress hormone that, in excess, can damage neurons in the hippocampus, the brain region responsible for memory. If you're using corticosteroids, especially for long periods, it is crucial that their use is carefully monitored by healthcare professionals. Never stop taking corticosteroids abruptly, as this can be dangerous. Instead, talk to your doctor about the possibility of gradually reducing the dose or exploring alternative treatments. Now let's talk about benzodiazepines. These drugs are widely prescribed to treat anxiety and insomnia, known for their calming and relaxing effects. Medications like alprazolam, diazepam, and lorazepam are effective in quickly relieving anxiety symptoms. However, prolonged use can have serious consequences for brain health. Studies have shown a clear association between the long-term use of benzodiazepines and memory loss. Research suggests that these medications can double the risk of developing Alzheimer's, possibly due to permanent brain damage. A study indicated that more than 40% of benzodiazepine users experienced a variety of neurological symptoms, including difficulty concentrating, lack of energy, nervousness, and increased sensitivity to sensory stimuli, in addition to memory loss. Prolonged use of benzodiazepines is also linked to a range of other adverse effects, such as sleep problems, anxiety, myalgia, and muscle weakness. Physical and emotional dependence is another significant risk, making it challenging for many patients to stop using these medications. The relationship between benzodiazepines and Alzheimer's is particularly concerning. Although the exact mechanism is not fully understood, it is believed that these drugs may interfere with the normal function of neurotransmitters, leading to structural and functional changes in the brain. Additionally, prolonged use can negatively affect the sleep cycle, which is crucial for memory consolidation. If you are taking benzodiazepines, it is essential that their use is carefully monitored and limited. Doctors should consider non-pharmacological alternatives to treat anxiety and insomnia, such as cognitive behavioral therapy, relaxation techniques, and lifestyle adjustments. When benzodiazepine use is necessary, it should be for short periods and at the lowest effective doses possible. Remember, never stop taking benzodiazepines abruptly, as this can cause severe withdrawal symptoms. Always consult your doctor before making any changes to your medication regimen. Now let's move on to some unexpected surprises: amphetamines and first-generation antihistamines. Continuing our list of medications that can affect brain health, these two types may surprise many people. Starting with amphetamines, including the popular Adderall, they are widely used in the treatment of attention deficit hyperactivity disorder, ADHD. ADHD medications such as amphetamines are well known for their ability to improve concentration and reduce hyperactivity in the short term. However, prolonged use of amphetamines can lead to significant adverse effects, including memory loss. Amphetamines work by increasing levels of neurotransmitters like dopamine and norepinephrine in the brain, which temporarily enhances concentration and focus. However, continuous use can lead to a range of problems, including physical and emotional dependence, sleep difficulties, irritability, and even depression. Memory loss is one of the most concerning side effects associated with the long-term use of these drugs. Studies have shown that high and prolonged doses of amphetamines can cause permanent brain damage. In addition to memory problems, long-term users may experience decreased motivation and overall cognitive performance. These effects can persist even after discontinuing the medication, indicating lasting damage. Another significant risk associated with amphetamines is the potential for abuse and addiction. Due to their stimulating effects, these drugs can be misused, leading to serious complications such as cardiac arrhythmias, digestive problems, and even sudden death. Psychological dependence can also be a significant challenge, making it difficult to stop using the medication even when adverse effects become evident. If you or someone you know is using amphetamines for ADHD, it is crucial that their use is strictly monitored by healthcare professionals. Therapeutic alternatives and non-pharmacological approaches, such as behavioral therapy and stress management techniques, should be considered as part of the treatment for ADHD. Now let's talk about first-generation antihistamines, such as chlorpheniramine and diphenhydramine. These medications are widely used to relieve allergy and cold symptoms. While effective in providing immediate relief from symptoms like congestion and itching, these medications have a darker side: long-term adverse effects on memory and cognitive function. First-generation antihistamines work by blocking the action of histamine, a substance in the body that causes allergic symptoms. However, they also have an anticholinergic effect, meaning they block acetylcholine, a neurotransmitter crucial for memory and learning. Prolonged use of these medications can therefore lead to significant cognitive problems. Studies have shown that first-generation antihistamines are associated with an increased risk of dementia. A recent review of 138 studies on the adverse effects of these medications found a strong association between prolonged use and cognitive disorders. Patients who regularly use these medications reported memory problems and difficulty concentrating even after stopping use. Fortunately, there are safer alternatives, such as second-generation antihistamines like loratadine and cetirizine. These medications have fewer side effects and are not associated with cognitive issues, making them the preferred choice for long-term allergy treatment. They offer effective symptom relief without the same risks to brain health. In addition to cognitive risks, first-generation antihistamines can cause other side effects such as drowsiness, dry mouth, and blurred vision. These effects can significantly impact quality of life, especially in older adults who are more susceptible to the adverse effects of these medications. To minimize risks, it is important for patients to consult their doctors before using first-generation antihistamines for extended periods. Considering safer alternatives and adopting other allergy management strategies, such as environmental and dietary changes, can help reduce the need for these medications and protect cognitive health. Remember, if you are using any of these medications regularly, do not stop abruptly. Always consult a healthcare professional before making any changes to your medication regimen. The unexpected tricyclic antidepressants and statins. We have reached the final topic on our list, where we will discuss two types of medications that may surprise many people: tricyclic antidepressants and statins. Let's start with tricyclic antidepressants. Medications like amitriptyline and nortriptyline were among the first developed to treat depression. While effective in alleviating depressive symptoms, these drugs have a side effect profile that includes memory loss and other cognitive issues. Tricyclic antidepressants work by blocking the reuptake of neurotransmitters such as serotonin and norepinephrine, increasing their availability in the brain. However, they also have strong anticholinergic properties, meaning they block acetylcholine, a neurotransmitter vital for memory and learning. Prolonged use of tricyclic antidepressants has been associated with an increased risk of dementia and other cognitive disorders. Studies show that patients who regularly use tricyclic antidepressants experience a faster decline in cognitive function compared to those who do not use them. These medications can cause difficulties in concentration, confusion, and both short and long-term memory loss. Furthermore, the risk of adverse effects is particularly high in older adults, who are more sensitive to the anticholinergic properties of these drugs. Fortunately, there are safer alternatives available today, such as selective serotonin reuptake inhibitors, SSRIs. SSRIs like fluoxetine and sertraline have fewer side effects and are not associated with memory problems. They are widely used to treat depression and anxiety with a better safety profile. If you're using tricyclic antidepressants, do not stop abruptly. Talk to your doctor about the possibility of switching to a more modern and safer alternative. Now let's talk about statins, a topic that has generated much controversy in the medical community. Statins, such as atorvastatin and simvastatin, are widely prescribed to lower cholesterol levels and prevent cardiovascular diseases. While effective in protecting against heart attacks and strokes, there is a growing body of evidence suggesting that prolonged use of statins may have adverse effects on cognitive function. Studies indicate that some people who take statins experience memory problems and mental confusion. Although these side effects are not common, they can be significant for those who experience them. It is believed that statins may interfere with cholesterol production in the brain, which is essential for synapse formation and cognitive function. A review of observational studies and clinical trials has shown mixed results on the relationship between statins and cognitive function. Some studies suggest that statins may protect against dementia, while others indicate an increased risk of memory problems. This discrepancy may be due to differences in the population's studied statin doses and treatment durations. It is important to emphasize that the cardiovascular benefits of statins are well established, and for many people, they outweigh the potential cognitive risks. However, it is crucial that patients and doctors discuss the potential adverse effects of statins and closely monitor any cognitive symptoms that may arise. In some cases, adjusting the dose or switching to a different statin can help alleviate side effects. Additionally, patients should be encouraged to adopt a healthy lifestyle, including a balanced diet and regular exercise to help control cholesterol levels and reduce dependence on medication. Remember, your brain is your most precious asset. Take care of it with wisdom and attention. Stay informed, ask questions to your doctor, and make conscious decisions about your health. Thank you for watching until the end. If you enjoyed this video, don't forget to give it a like, subscribe to the HealthHack channel, and activate notifications so you don't miss our next content on health and wellness. See you next time.